Good morning. I see you are here for a cranial nerve exam. Perfect. I also see you missed the pre-check-in, so I'm going to just complete that right now if that's okay with you. Okay. So, let's get started. Just typing up your name, and can you confirm your date of birth? And I know you are a new patient. And who is your primary care physician? Okay, and so you were referred just for a basic cranial nerve exam. Okay, so no accident. Do you have any known allergies? Do you take any prescribed medication? And what are your symptoms? And so no symptoms, just a checkup. I'm just going to name a few though. Just let me know if you've experienced them within the past year, okay? Fever, extreme fatigue, weight loss, weight gain, unusual bleeding, headaches, any weakness or numbness, have you fallen at all, lost your balance, any difficulty falling asleep or staying asleep, okay, and then any joint pain. Okay, and then I just need your emergency contact. So first name, and last name, and then phone number. Perfect. Alright, so we can get started. Are you comfortable? Perfect. So let's see. I think I'm going to start with your sense of smell. And so what I'm going to do is just take one at a time and just place the scent right under your nose. And you can let me know what you think it is. So let's start with this one. Okay. So scent number 1. Do you know what that is? Very good. That one is strawberry. Let's go to this one next. And what about this one? Very good. This one is peppermint. And some of them might be a little bit tricky, so if you have trouble, just let me know. Okay. Next one. Yeah, that one is kind of tricky, but you are correct. It's a very light scent, so that's why it's kind of tricky. Let's go to this one. What do you think? Good, good. Yeah, that's kind of a tricky one too, but it is peach. Next one. Just 2 more to go. Good. That is bubblegum. One of my favorites. Okay, and then the last one. All right. What do you think? Perfect. Watermelon. Another one of my favorites. Alright, so no trouble smelling these. Okay. Perfect. Now, taste test. So I'm just going to place 2 different drops on your tongue, one at a time. Just tell me what flavor it is. And again, you said no allergies. Okay. Perfect. Alright, so first one. One, 2. Yeah, perfect. So just a very sour tart taste. Very good. And now this one. Again. 1, 2. So what do you think about that one? Very good. Just gonna tape up a few notes from that part, okay? So, perfect. And you have not lost your sense of taste or smell in the past year. Okay, and have you ever? Okay, good. Now just a quick cognitive test to switch it up. So on this page right here, can you tell me how many red characters you see? And these specific characters are called Pikmin. So I'm going to bring it up close. Just count all of the red characters. Very good. 1, 2, 3. Let's see. 2, maybe 1 more. Alright. So for this one, can you just take your finger and start with one of these characters, and then just follow the line all the way to the corresponding item. Okay? So you can choose which one and go right ahead. Very good. So you did do it perfectly, and you didn't have any trouble comprehending, right? move on to your eyes next. And remind me, no issues with your vision. Okay. So we're going to start with covering one eye at a time. Start with your right eye. Okay. And now just tell me when you see my finger wiggling in the background. Okay. Good. 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 Now the left eye. Same thing. Good. 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 So I just have some color sheets here, and I need you to tell me what color you see. And I'm going to just cover your eyes again, just like we just did. So I'll cover your right eye again, and just tell me what color you see. Good. Good. Yeah, it's kind of like a turquoise. Now, same thing, but switching sides. So first color. Good. Second color. Good. And then third color. Good. Alright, so you did that very quickly. So no issues, right? Perfect. So now I just want to check your pupils just to make sure everything is reacting properly. So I'm just going to gently lift your eyelid. Does that hurt? Okay, good. Okay. Just gonna leave it there for a moment. Good, you can take a break and blink. I'm gonna look one more time. Good, good, good. Okay. Now your other eye. Okay, just hold it. Just gonna look in this one. Blink again. And I'm just gonna hold it again. Okay. And now look straight at my nose. Good. Good job. Okay. Now just follow this light with just your eyes. Good. Good. Okay, now I'm just going to lower the light a little bit. Alright. So I need you to first just look up for me. Just gonna hold your eyes again. Good. Very good. Okay. Now look down. Look to the left for me. Very good. Can you blink? Perfect. Now look to the right for me. time. Perfect. I'm going to turn the light back up. So I'm just taking a few notes. And then we will move on. We're almost done. And you're doing great so far. Alright, so I'm going to have you shrug your shoulders up for me. Good. Now look all the way to the left. Good. Now look all the way to the right. Any pain when you did that? Good. Now can you just roll your head in a circle like this to the right? Okay, now reverse and go to the left. Good. Now just stand up for a moment. Good. And just walk toward me. Perfect. Okay, you can walk back and sit down. So let's actually do your face movement next. So can you close your eyes for me? Now open them. Close them. And open them. Raise your eyebrows. And then bring them back down. Raise them again. And bring them back down. Okay, good. And can you yawn for me? Okay. Now stick out your tongue. And then just move it to the left. And then move it to the right. Okay. So for all of those exercises, did you feel any pain? Okay, good. So I was just testing your muscles, making sure nothing seemed abnormal. So now, similar to that, we're going to do your face sensation. Alright, so we will start with the sharper dull test. So the dull sensation you will feel is this cotton swab just brushed on your face. And then this is the sharp sensation, but don't worry, it doesn't hurt. It's just like a very light, prickly feeling. Okay? So close your eyes and let me know if you feel sharp or dull. Good. 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 Now, same thing, except we're going to do hot or cold. So here is the cold. And this is just a water globe that's commonly used for facials. Okay, it's a little bit cold. It was in the freezer. And then the warm will just be the touch of my hand. Okay? Alright, here we go. Good. 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 Okay. So any numbness? Okay. And And you did not hesitate for any of those answers. So I'm assuming no challenges. Okay, perfect. So then just one more thing. I would like to just do a quick hearing test. So I will be using a tuning fork. Do you know what that is? Yeah, so it just makes a vibration sound. So I'm just going to strike it, put it on one side of your head, and make sure you hear it. So as soon as you hear it, just raise your hand for whatever side it's on. So I will need you to close your eyes. Very good. Alright, so first one. Very good. And now the second one. Very good. And then I'm just going to put it on the top of your head and just tell me if you hear the vibration in both ears. Alright? Very good. Alright, so no challenges. Perfect. Just typing up my final notes, but overall, everything is perfect. I don't see any signs of cognitive issues. Now, if you were to start having memory loss, start not comprehending things, or of course if you're in an accident, which hopefully you never are, but if you are, if you have any concerns about your cognitive function, please come back in. I think you're covered for one every year under your insurance, but if there's an issue, we can obviously get you in right away, okay? Now, any questions for me? Perfect. Well, I'm glad that you are in good health, and please give me a call if you need anything at all, okay? Alright, well, take care. Thanks for coming in, and I will see you next time.